U.S. Senator Elizabeth Warren of Massachusetts wants the federal government and her state's government to crack down on what she is referring to as, quote, so-called crisis pregnancy centers. And she's saying so-called because they don't abort babies. Here is what Warren said last week.
Here in Massachusetts, these so-called crisis pregnancy centers outnumber genuine abortion clinics by 3 to 1. They are giving it over to people who wish them harm, and that has to stop. We need to put a stop to that in Massachusetts right now.
Well, she is correct about one thing. They do outnumber the abortion clinics. There's about 3,000 of these care pregnancy centers that dot the landscape of America, and it's because people do care. And these are all funded by individuals, by churches, by others who care about women and their unborn children. They don't make a profit like the abortion industry does. So yeah, there's a big difference. The reality is it's the abortion industry that has been and continues to engage in deception and disinformation. I mean, this is what I would call a classic example of projection. This is what they're doing, but they want to project onto the pro-life community. Now, Warren has introduced a bill in Congress, Stop Anti-Abortion Disinformation Act, or the SAD Act. Now, it's designed to crack down on care pregnancy centers, again, simply because they won't kill babies. And that is what I call sad. Joining me now to talk about this and more is Dr. Donna Harrison, a board-certified obstetrician and gynecologist who is presently CEO of the American Association of Pro-Life Obstetricians and Gynecologists. Dr. Harrison, welcome back to Washington Watch. Thanks for joining us.
Thank you for having me.
So let me just get your initial thoughts on Senator Warren's bill and what she's calling her home state to do when it comes to these care pregnancy centers.
Well, I have reviewed Senator Warren's bill, and it is a remarkable piece of lack of information and lack of documentation and lack of accuracy regarding what pregnancy care centers actually do. So I have a dog in this fight because I'm on the medical advisory board for CareNet. And I am familiar with the massive amount of love and outpouring of just genuine compassion that the pregnancy care center volunteers give to women every day in this country, 3,000. And also the physicians who are involved. There's over 10,000 physicians involved with pregnancy care centers. We give accurate medical information. Unlike the abortion clinics who say, well, you got a blob of tissue in there, we give accurate information about what a baby or what a human being is and their stage of development at each gestational age, so the mom actually has information to make an informed decision. And the pregnancy care centers, as you pointed out, don't financially benefit from this outpouring of love and compassion. They give it free to the patients that come in. And so if there's any group of people that are empowering women and caring for them, caring for their needs, it's the pregnancy care center volunteers and the physicians who are helping them.
So, Dr. Harrison, now, are you saying that the abortion clinics, Planned Parenthood, they don't give away free abortions?
Not that I know of. What they do is they coerce people, especially women who are in a crisis situation where they are truly looking for an answer. But rather than giving women information, accurate information about how far along the baby is, what the baby looks like by ultrasound, what the real risks and complications are of an abortion, instead of that, the abortion industry pushes abortion as the only option that this woman has. And so it's not surprising under that high pressure marketing technique that women choose abortion and later come to regret that abortion.
Right.
So
yeah, I was just going to say the last numbers I saw, it's been a couple of years, but the Planned Parenthood in particular it's a nonprofit, but it ran a profit of about almost $1 billion when it came to abortions that they were doing. And you compare the care pregnancy centers, and I've been on the board of one for about 25 years, and full service. I mean, they have, as you said, they have doctors, they have nurses, they do ultrasounds, they do the pregnancy test. I mean, they do everything. And you compare that with the abortion industry, with groups like Planned Parenthood. 2020, 354,871 abortions were performed. Planned Parenthood offered, out of that, compared to that, 8,626 instances of prenatal care and only 2,667 adoption referrals. 96% of their activity was abortion. So, I mean, I've always thought, look, you want to find out what's going on, follow the money. This is about money for the abortion industry. They are making money every time a woman crosses through the doors of those abortion clinics.
That's true. And I have in front of me a report done by the Charlotte Lozier Institute that talks a little bit about what pregnancy care centers have done in 2019. They provided services at a value of over $266 million, and that was for free. And they did this with 53,855 volunteers, 14,000 total staff, and 10,000 licensed medical professionals, of which there were 3,000 of those physicians who were on staff and 6,000 who were volunteers. So follow the money. We've got an outpouring of compassion and love and accurate information for women being given at pregnancy care centers across the nation. And that's threatening to the bottom line dollar of Planned Parenthood.
Yeah, I often speak at the fundraising banquets for many of these care pregnancy centers across the country, and it's all privately given. People care about these mothers and their children. And, I think, in part, they see this as a tremendous threat to them and to their bottom line, because what's going to happen with the Dobbs decision and this going back to the states, we already have 26 states that are already moving into the pro-life column, is that this is going to create more care pregnancy centers across the country. Because I believe the pro-life community is going to step up and they're going to be providing more services, helping more women. I think you're going to see the creation of new adoption agencies that are going to, I think this is going to be an explosion of pro-life activity. And guess what? They're not going to be making any money, and they're not going to be able to get their hooks into these women.
Well, agree. And if you look at the narrative that's coming from the abortion industry, it's very impoverished. They're only for one choice, and that is for the choice of abortion. Whereas pregnancy care centers walk women through not only what an abortion is, but also provide services and real services that will help women to carry through with the pregnancy or to adopt that baby. This isn't like what the pregnancy care centers do is not like what the abortion clinics do. The abortion clinics are a one and done. They do not consider, they don't follow up with their patients. They don't really care what the situation was that created this crisis. Pregnancy care centers, on the other hand, provide diapers. They provide referrals for job training. They do all kinds of things for women, put them into support networks. And you don't see anything like that on the abortion side.
Right. Well, Dr. Harrison, I want to just touch on one thing you just mentioned, because I think this is so important. It's the why. Why did this happen? Were you exploited? Was it a bad relationship? What drew you to this? What was missing in your life? And this is where the spiritual aspect comes in, that so many of these care pregnancy centers share the love of God, both in actions and in words, and it's transformative. I mean, I cannot tell you the number of young women that I have seen whose lives have been transformed. Not only did they keep their children, the child that they were pregnant with, but they themselves experienced a new birth, which gave them a new lease on life and a whole new outlook addressing the underlying issues.
Mm-hmm. And I'm so glad you brought that up, because What the abortion industry does is breathe out despair. And what the pregnancy care centers do is breathe out hope. So if you want to read and weep something, go to the Guttmacher website and Google reasons women abort. It will break your heart. There's a large amount of abandonment and coercion that are themes of why women abort. They're alone. They don't have the financial support to raise a child or another child. And all of this is about feeling vulnerable and the abortion industry taking advantage of women in a vulnerable situation. So the pregnancy care centers breathe into that situation hope. We can walk with you. We can provide you with love and care and compassion. And that's the big difference. As you mentioned, it's the difference between despair and hope, and the hope doesn't disappoint.
Yeah, absolutely. Dr. Harrison, I want to switch gears for just a moment. We just got a couple of minutes left. There's been a push from the Biden administration for expanded access to abortion pills. In fact, we know last numbers we saw, over half of abortions came through the abortion pills. They've changed the rules. You don't have to have a face-to-face medical appearance. I mean, you don't have to have a doctor actually look to see what stage you are in gestation in your pregnancy. What are your thoughts about this push of making sure, doubling down on these abortion pills by the Biden administration?
This is horribly dangerous for women. Even if we forget for the moment that there is a human being who's destroyed by these pills, let's look at what it means to do a do-it-yourself abortion. You don't know how far along you are in pregnancy. Your risk for surgery increases from 1 out of 20 to 1 out of 3 if you're just 3 weeks further along than 10 weeks. So by 13 weeks, you got a 1 out of 3 chance of needing emergency surgery for hemorrhage or tissue left inside. You don't know where that baby is at. 1 out of 50 women have the baby implanted in their tube. That's called an ectopic pregnancy. The symptoms of a mifeprex abortion, a chemical abortion, are pain and bleeding. The symptoms of a rupturing ectopic pregnancy are pain and bleeding. And there have been women who have had pain and bleeding, called the abortion clinic and have been told, honey, just take a Tylenol and lay down. And they bled to death because they had a rupturing ectopic pregnancy, which you are not supposed to give mifeprex, the abortion drug, in the presence of an ectopic pregnancy. That's one of the reasons why a in-person visit with an ultrasound is absolutely critical to minimizing the risks of this dangerous drug. And to make matters worse, some women are Rh negative and they need a medicine called Rogam when they're having an abortion. How are they going to get that if they're getting the drug through the mail and no one is knowing or checking for that? And what's even worse is with mail order drugs, how do you know who's even getting the drug? There have been cases over the last 5 years of disgruntled boyfriends who have ordered the drug and crushed it up and put it in their girlfriend's smoothie. How about the pimps and abusers that order the drug so they can manage their herd? The possibility for coercion is tremendous. And this is no help for women. Women are being put in a dangerous situation and they're being lied to about how dangerous these drugs are. They're dangerous. They're 5 times more dangerous than a surgical abortion.
Dr. Harrison, you mentioned the Charlotte Lozier Institute. They also, in a study, found that there has been a 500% increase in emergency room visits by women taking the abortion drug in the last decade, and that's before the change of this policy, making them available through the mail.
Yes, I and several other American Association of Pro-Life OB-GYN members participated in the analysis of that study. And that's true. Women are being told that when they have a complication, they don't call the abortion clinic, they just go to the local ER. So the abortionists are dumping their complications on the local ER, and the emergency room doc may or may not even know that the woman has had a chemical abortion. We did another study recently from the same Medicaid database looking at what's the risk if the ER doctor doesn't know that there's a chemical abortion. And these are women who paid for chemical abortions, and the ones who don't tell the ER doc, they end up with 3 times as many hospital visits as the ones who do tell the ER doc that they're aborting, and they are much higher risk of being hospitalized and having surgery. So it is important that women not lie to the ER doc, that they tell them exactly what happened for their own sake, so that the women can get appropriate care.
And this policy that this administration is pushing needs to be reversed, where the medical provider, at least they have to go and see a doctor before they get this abortion pill. This is outrageous that they're doing this. Dr. Harrison, we're out of time, but I do want to thank you for joining us and appreciate the work that you're doing on behalf of mothers and their unborn children.
You're welcome. Thank you for having me.